This patient is a 30-year-old male who is concerned about possible exposures from his neighbor's gas well. His neighbor has had a gas well drilled but not yet fracked on his property. The patient, you were on vacation, the patient came in and saw your covering physician, your covering colleague, and because this patient was concerned about exposures, your covering colleague had performed a urine heavy metal screen and had detected elevated arsenic. So he's now coming in to see you because he's been told by the office that he has elevated arsenic in his urine. He hasn't had any water testing done, and he's also concerned, after learning that he had elevated arsenic, he recalls that he's had some intermittent right hand numbness, and he's concerned about that in addition. Would you have tested this patient for arsenic? We hear about arsenic, people, arsenic being associated with hydraulic fracturing, but this person, haven't even documented that he has an exposure. Well, I guess I could go into the answers here, yeah. It's best to identify a specific exposure through environmental testing. So if you were worried that this person had been exposed to arsenic in his well water, better to test the well water first. So, but you still don't know what this well water is. He's sitting in your office, and he's been told that his 24-hour urine showed 500 micrograms per liter of arsenic with a lab normal of less than 35. As I said, he's seeing you in follow-up. He's concerned about his hand numbness. He wants to be chelated. He wants to be tested for everything. Now, based on the urine arsenic results, has your patient experienced a toxic exposure to arsenic? Whether you would have tested it or not, has he experienced a toxic exposure to arsenic? But urine arsenic reflects all sources of arsenic exposure. And I bring this one up because we heard about a bunch of physician testing of urine arsenic without understanding about testing for urine arsenic. So you guys know this because that's what you do. But arsenic can also, you can have toxic inorganic arsenic, and that's what you sometimes see in well water. But there's also there's organic arsenic in seafood that is not toxic. So in order to do arsenic testing appropriately, you either have to have your patients abstain for at least 3 days prior to the test, abstain from seafood. And you have an alternative. If you now have this urine result, an alternative is to have it speciated for toxic and non-toxic forms. So that is more expensive than doing it correctly to begin with. And I mean, this is one of the problems with getting a test result that wasn't indicated in the first place. So he's also noted some intermittent right hand numbness for the past few months. Sometimes wakens him at night. He doesn't have any foot numbness. It only affects his right hand. He's right-handed. He's otherwise healthy and non-smoker. He has no diabetes, arthritis, or thyroid problems. He lives alone. He's employed as a mason. He's recently been working overtime doing construction related to the gas boom. And he does use the internet several hours a day. Remember, you still don't know, because you're given this result, that you don't know whether it's a problem or not. That's still in the background at this visit. He's healthy appearing. Pulse may be a little bit high because he's anxious. And the only other finding was a positive Tinel's test over the median nerve in the right wrist. And that's a test for nerve irritation in the wrist. Is your patient's hand numbness likely to be related to an arsenic exposure? No, was the answer. But arsenic can cause a peripheral neuropathy, but this is not the usual pattern. He's got other risk factors for carpal tunnel syndrome. The usual pattern in arsenic neuropathy affects stocking glove distribution, both the hands and the feet. Would you consider chelation for this patient? Chelation is rarely used for arsenic toxicity except in acute poisonings. Should he undergo a post-challenge urinary metal test to determine if chelation related to other potential exposures is appropriate? And some of you may not be familiar with what this is, but and I only brought it up in this forum really because we had seen patients that were having chelation testing for their hydraulic fracturing well water exposures. This is something that where a practitioner, so you have somebody who comes in, has some health complaint, no identified exposures, and the practitioner gives them a chelating agent and then collects the urine for 6 hours afterwards and sends it off to a lab. But we all have heavy metals in our body, a little bit stored in our bones or other places which are doing absolutely nothing to us to cause any toxicity. So, but if you give somebody a chelator, it draws those out and dumps them in the urine. Then you send the urine off to the lab, and the lab finds metals in the urine, and they compare it to a range of values which are done on a non-chelated person and tell the person that they have elevated metal levels. And then they undergo chelation therapy, which I will just quote the American College of Medical Toxicology on this. It is the position of the American College of Medical Toxicology that post-challenge urinary metal testing has not been scientifically validated, has no demonstrated benefit, and may be harmful when applied in the assessment and treatment of patients in whom there is concern for metal poisoning. And because this has come up in our cases, I put the whole American College of Medical Toxicology's position statement in the toolkit. And this explains the data behind that. I mean, there have not only been fatalities related to that, but in animal studies, including primate studies, it has been shown that if you take a really lead poison primate and chelate them, that improves their mental state, their neurobehavioral state. If you take when compared to a non-poisoned, non-chelated primate, if you take a non-poisoned primate and chelate them, then you worsen their neurobehavioral state. So you actually are doing harm to their brains by chelating them. And that's because these agents draw out, well, we don't know exactly all the reasons why, but these agents draw out metals that we need in our system. Would you test him for other chemicals in his system? I think we've already gone over this. The decision to perform blood or urine tests should depend on environmental testing documenting of potential exposures. You can test for anything in the blood, but there often aren't health-based reference ranges to interpret results. We have these population-based reference ranges that Pune was talking about, but that doesn't say anything about if somebody's above the 95th percentile. Does that have any health implications? You also have to consider the toxicokinetics of the chemical, so understanding the half-life, the excretion route. It doesn't make sense to be testing for VOCs in someone who is most likely had their VOC exposure pumping gas on the way to the office, as opposed to what they were exposed to a day or two ago at home, because that's all gone by now. And you have to understand the overall sensitivity and specificity of the testing process. And that means that if your patient has been exposed, is the test going to detect that? And if your patient hasn't been exposed, is the test going to be negative? What you see sometimes is people that may have been exposed, but they've done a test and then it comes back negative, and then they are told they weren't exposed. And that is as harmful as some of the other testing that we have talked about. And then you have tests where there are multiple factors that can impact the results, such as for volatile organic chemicals, you may be concerned about a particular exposure, but the test is measuring all exposures, and it may come back positive, but it may not say anything about the particular exposure that you were concerned about. And before you do any tests, know in advance how the results will influence your treatment and recommendations.